Sir, what is andrology?
Andrology is a branch of medicine which deals with male problems. For example, gynecology deals with the female problems. And opposite to that word is andrology.
Is sex harmful, sir?
No. Sex is a type of exercise, just like running. What are all the changes occur during running or any aerobic exercise? During sex also the same thing will take place. For example, heart rate goes up, BP goes up, one will be getting tired, one will start sweating. All these things occur in any aerobic exercise. As you know, all aerobic exercises improve the longevity of the life.
Who needs consultation, sir?
Before marriage, almost everyone should consult, especially in the era of HIV, and whoever is doubtful of their potency or whoever is having some problems like impotency, or after the marriage, especially around 40, so many hormonal changes take place in the body. So after 40, almost everybody should consult. And especially for diabetic people, the erectile dysfunction or the impotency will start very early, so they should consult as early as possible.
What are the investigations required?
Most of the investigations are simple blood tests. Very few special investigations are there, like RIG scan, a cyst test, a penile Doppler study.
What are the treatments available, sir?
The treatment is very simple. Oral medication like Viagra like tablets. Second thing is the injection into the penis. Third is, if nothing works out, there is a surgery known as penile implant surgery, which gives strength to the penis.
So, what is microsurgery?
Microsurgery is a surgery which deals with the small structures. With the help of a microscope, we do the surgery. It is very useful, especially in male infertility as well as the recanalization as well as vasovasostomy.
So, what is urology, sir?
Urology is a subject which deals with the urinary system. The system starts from the kidney, ureter, bladder and outlet.
So, what is gynaeurology, sir?
Gynaeurology is a subject which deals with urinary problems in females.
Oh. Male erectile dysfunction.
This is a model of male organ which is soft, but whenever man thinks about sex or indulges in sex, this becomes hard. Not only the hardness, the length also increases. Most important thing is hardness. A model like this will become like this. So this will be able to enter inside the vagina, that is the female organ. To enter into the female organ, it should be strong enough. It should not be soft like this. The softness will not be able to allow, whereas hard structure can easily enter. So inability to gain the hardness is known as erectile dysfunction.
So what is cyst test?
Cyst test is a test in which combined injection and stimulation. The injection, vasoactive agents like papaverine is given. At the same time, we will provide a pornographic booklet or a video cassette, and we measure the length as well as the width of the penis. Penis, usually when it is soft, it is around 20 millimeters at the base, and once it becomes rigid and hard, it may gain about 10 millimeter extra, and the tip will be around 20 and it will become 30. So the length also increases. Usually it is around 7 centimeters this length, and it may touch up to 10 centimeters depending upon the race.
So what do you mean by penile axial rigidity evaluation?
This has got a strength. If I press it, it cannot get into it. Whereas if I press this soft structure, it is going inside. So the ability to withstand the pressures from outside is the rigidity. This rigidity, if I can twist like this, it once again comes normal. So this is the axial rigidity. In penile axial rigidity, what I do is, I put a instrument like this over the penis and I will go on add weights over it. So it should withstand 500 grams. Beyond 500 grams, if it buckles, that is normal. But if it buckles around 450 or 400 grams, that means the rigidity is insufficient. It may not be able to enter into the female organ.
So what is surgery for priapism?
Priapism? Priapism is a sustained painful erection of the penis beyond 6 hours. So in that case, we have got non-surgical methods as well as surgical methods to do it. In non-surgical methods, we give some drugs like terbutaline. In semi-invasive techniques, in corpora cavernosa, we introduce a needle and we take out the blood around 100 to 200 ml. And if surgery is required, we may create the corpora. This is known as glans. This is corpora cavernosa. Here we make a wedge-like structure, and so that whatever the blood is here, it goes into the glans and it goes inside. And there is one more surgery. It is done in the perineum.
So what do you mean by early ejaculation?
After entering into the vagina is the female organ, this penis becomes soft and it starts secreting some secretions, that is known as ejaculation. So to have a satisfaction to the partner, it should be able to enter, stay there for some time. If it does not stay there for some time as hard, the partner will not get satisfaction. That condition is known as early ejaculation. Previously it was known as premature ejaculation.
What is vibratory treatment for ejaculatory problems?
Some people do not ejaculate in their lifetime. Sometimes it is conditional. So we keep a vibrator, not the one which we use for massage, a special vibrator kept in the vagina, in the undersurface of the penis, so that the penis gets vibrated, it gets stimulus, and ejaculation comes out from here.
So what do you mean by vasovasostomy, sir?
Testicles or the balls in males, from there the sperms will travel and enter into the penis. So there is a small tube which carries the sperms from the testes to the penis is known as vas. In male family planning operation, that tube is ligated and cut. In vasovasostomy, we create a communication in between the cut ends of the vas. So that is known as vasovasostomy.
What is tuboplasty, sir?
Tuboplasty is done similar in a female structure. This is the female model. Here it is vagina. This is known as cervix. This is all uterus. From here you can see a tube. The tube is coming like this. Through this tube you can see a water bubble like thing from the ovary. From here ova gets released, gets enter into this tube and it comes to the uterus. At the same time, during intercourse the sperms will travel up. So once the female ovum and a male sperm join together, that causes the child. Here this tube is ligated in family planning operation. So this tube, once again we develop a communication in between the cut ends, that is known as tuboplasty.
What do you mean by testicular biopsy with needles?
Testicles are the balls in a male. Instead of cutting and opening the scrotum, with the help of a needle only, we take out a small portion of the testis and that is sent for the investigation. Under microscopy, the pathologist will read about it and tell whether sperms are getting generated or there is any problem in the testicle. That is known as testicular biopsy with the help of needle. This is the photograph of a 25-year-old male. You can see his penis is only 2 centimeters. Unfortunately, it could not grow because of certain reasons. This is known as infantile penis. Here you can see 2 scars. Unfortunately, during childhood, both the testicles were removed when they could not descend. And that is the cause of infantile penis. This is the vibrator which we use for the ejaculatory purposes. It is different from the routine massaging vibrators. Its strength is different. Here it is to measure the length of the penis. We use a special scale. This is orchidometer. To measure the volume of the testicle, we use it. We also use it for the measurement of the girth for the penis at the base as well as at the tip. This is a vacuum pump. Here, in a vacuum pump is kept over the penis. Air is removed through a machine from this side. So penis gets enlarged and stronger like this. So previously when drugs were not available, this was one of the methods used, but it is quite ineffective. This is a penile implant, sir, where nothing works out, like no medication works, no injections are not sufficient to give the rigidity. Then this implant is kept by the surgery. It is inserted in the penis and that gives strength to the penis. You can see it is soft, it is malleable, but still it gives strength, and that's how it is adjusted to the size of the penis in the length as well as in the thickness, and it is introduced in the penis. It will last at least 10 to 15 years, and this is sufficient to have sex for hours together. This is an artificial penis. It is worn with the help of a belt and sex is done. It is mostly useful to the partner rather than the person. Of course, sexual satisfaction comes through the satisfaction of the partner.